Friends, the channel Knowledge and Entertainment welcomes you to yet another informative video. Today, we'll be discussing an essential life-saving procedure known as CPR, Cardiopulmonary Resuscitation. Before we begin, we want to emphasize that this video is for informational purposes only and should not be used as a replacement for expert medical advice. CPR, which stands for Cardiopulmonary Resuscitation, is a life-saving emergency procedure used to maintain blood flow and oxygenation to the brain and other vital organs when a person's heart has stopped beating or is beating ineffectively. CPR combines chest compressions and rescue breaths to circulate oxygenated blood throughout the body until professional medical help can be provided. Situations in which CPR may need to be initiated include cardiac arrest, when a person's heart stops beating or is beating abnormally, leading to a lack of blood circulation and oxygen supply to the body. Drowning, a person who has been submerged in water and is unresponsive may require CPR to restore breathing and circulation. Choking, if a person is choking and becomes unresponsive, CPR may be necessary to dislodge the obstruction and restore breathing. Electrocution, in cases of severe electric shock that cause cardiac arrest, CPR may be needed until medical professionals can take over. Drug overdose, in some drug overdose cases, the heart may stop or beat irregularly, requiring immediate CPR. Friends, now we will talk about steps for performing CPR on an adult. Assess the situation. Check the person for responsiveness by tapping and shouting. If the person is unresponsive and not breathing normally, call for emergency medical help. Position the person. Lay the person flat on their back on a firm surface. Open the airway. Tilt the person's head backward slightly, lifting the chin to open the airway. Check for breathing. Look, listen, and feel for signs of breathing. If the person is not breathing or only gasping, proceed to CPR. Start chest compressions. Place the heel of one hand on the center of the person's chest, just below the nipple line. Place the other hand on top of the first hand and interlock the fingers. Use your body weight to compress the chest downward at least 2 inches, that is 5 centimeters deep, at a rate of 100-120 compressions per minute. Allow the chest to recoil completely between compressions. Provide rescue breaths. After 30 compressions, give 2 rescue breaths. Tilt the person's head back slightly and lift the chin. Pinch the person's nose shut and cover their mouth with yours to create an airtight seal. Give 2 breaths that make the chest rise visibly. Continue with cycles of 30 compressions and 2 breaths until professional medical help arrives. The person starts breathing on their own. You are too exhausted to continue. Use an AED, automated, external, defibrillator, if available and you are trained to use it. Apply the AED as soon as possible. Remember, if you're not trained in CPR, provide hands-only CPR, chest compressions only, until professional help arrives. It's essential to take a CPR course to become familiar with the proper techniques and to receive certification. CPR can significantly increase a person's chances of survival in a cardiac emergency, so learning how to perform it can be a crucial skill to have in emergency situations. Friends, thank you for joining us in this informative video on CPR. We hope you found the demonstration helpful in understanding this life-saving technique. If you enjoyed this content and found it valuable, please consider giving us a thumbs up, sharing it with your friends and family, and subscribing to Knowledge and Entertainment for more insightful videos on various topics.